Welcome friends and students to my channel. Today we are going to learn etiopathogenesis of pre-renal ARF. Okay, what is ARF? The full form of ARF, that is acute renal failure. It is also called as acute kidney disease or acute kidney injury. As the name suggests, acute, it is for short period of time, precisely for hours to weeks, and for that particular period of time only there would be the decreased function of the kidney, hence there would be a decreased filtration rate, and ultimately what we can say clinically, that is a decreased glomerular filtration rate. Okay, so that is the event called as acute renal failure. One of the common types of the ARF condition, that is a pre-renal. So in this particular video we're gonna understand how the pre-renal ARF occurs and what is the exact mechanism, pathogenesis of pre-renal ARF. Let's understand this. So the central phenomena in this particular pre-renal ARF, that is a decreased blood supply towards the kidney system or renal system. In another way we can say that renal ischemia, that is the central event responsible for pre-renal ARF condition. How does it arrive? How does it occur? There are two particular phenomena. One is absolute loss of fluid and another is relative loss of the fluid. Once again, what is pre-renal ARF? Pre-renal ARF is a decreased blood supply towards the kidney. Now, the problem is not there inside the kidney. There is no any intrinsic damage into any part of the kidney, that can be the glomerulus, tubules, interstitium or any, but the problem is before the kidney system. That is a decrease in the blood supply, and that is why this particular type is known as pre-renal ARF. The one of the common phenomena, that is absolute loss of the fluid. Absolute loss of the fluid is the condition in which the overall depletion of the fluid in the body. There is not only the declination of the blood, but the all fluid in the body which is there in the extracellular space, that all fluid is getting lower down, that is absolute loss of the fluid. Which are the underlying conditions in this particular category? One of the common ones, that is a severe burns. In that condition there would be the evaporation of the fluid from the body, and obviously due to that there would be the significant depletion of the blood in the circulatory system. That is why the renal system will receive less amount of the blood, leads to renal ischemia. Next condition, that is a major hemorrhage. If there is a severe injury in the body, head trauma or any kind of the severe injury, severe road accident, in that condition there would be a massive loss of the blood from the body. Not only that, the fluid is also getting lost. So in that condition also the renal ischemia takes place. And another conditions are severe vomiting and diarrhea. Yes, please mark my word, severe, not minor to moderate. Severe vomiting and diarrhea condition is also responsible for decreased fluid and ultimately the decreased blood supply towards the kidney system. Okay, so these are the different conditions. Another condition, that is a relative loss of the fluid. Relative loss of the fluid, it is the condition in which there is a less amount of the blood in the circulatory system. Overall amount of the fluid in the body doesn't get impacted, but the volume of the blood in the circulatory system is less. That is known as what? Relative loss of the fluid. Okay, the first condition, that is a distributive shock. In distributive shock condition, whatever the fluid is there in the blood vessel is getting moved into the extracellular space. Whatever the blood is there in the circulatory system is moved into the extracellular space, and that is why the blood volume in the circulatory system decreases, and that is responsible for what? Decreased blood volume in the circulatory system leads to decreased blood supply to the kidney. Okay, are we clear with this? Distributive shock condition. Okay, so overall fluid in the body is remain same, but the volume of fluid in the circulatory system, in the blood vessel network is getting decreased. That is known as distributive shock condition. Another very common condition, that is a congestive heart failure, as we all know, in which the left ventricular function is getting affected, and that is why ejection fraction is getting affected, decreasing the cardiac output, and that is why the blood supply towards the kidney decreases, leads to renal ischemia events. Another is renal artery stenosis. As we all know, the renal system is highly dependent on blood supply. For your knowledge information, I must say to you that overall body's blood supply, from the overall body blood supply, renal system requires 25% of the blood volume. Okay, so it is highly dependent on the blood for its function. Okay, so what happened in this particular condition? Whatever the major arteries and arterioles are there, especially afferent renal arteriole, it is getting highly narrowed down. There would be the massive narrowing of the renal arteriole, especially the afferent renal arteriole, and due to that, the renal system, especially the first part of the renal system responsible for the filtration, that is glomerulus, receives less amount of the blood, and that is why renal ischemia takes place. So that condition is known as renal artery stenosis. Specific part of the artery or arteriole is getting narrowed down. And another very common condition, that is atherosclerosis, as we all know very commonly. It is the hardening and thickening of the artery and arterioles, and due to that, narrowing of the lumen of the artery. And that is why the blood supply towards the kidney lowers down. Okay, so I hope you have understood all the conditions responsible for pre-renal ARF. Now let's understand the pathogenesis. It is very simple. Yeah, believe me, it is really very simple. We should just know the basic concept. Okay, so here the major phenomena occurs is what? Decreased blood supply to the kidney, and that is why there would be the decreased renal blood perfusion. Kidney system gets lower amount of the blood, and that will lead to what? The major function of the kidney, that is filtration. So filtration gets low down, and filtration by the glomeruli is getting decreased, and the central event occurs, that is what? Decrease in glomerular filtration rate. Once again, please speak with me. Decrease in glomerular filtration rate. Okay, so that is the main phenomena occurs. There are two outcomes of decrease in the GFR. Let's focus on this. If the GFR decreases, if the filtration decreases, obviously the amount of fluid which is being filtered or amount of fluid which is being passed from this filter, that is the glomerulus, decreases, and that is why ultimately the urine output decreases. Obviously kidney is filtering less amount of the fluid, or you can say blood, so ultimately the production of the urine is also getting decreased. So decreased urine output, and clinically, technically, it is known as what? Oliguria. Please mention this word. It is known as what? Oliguria. And you can also write down the value when the urine output is less than 400 to 500 ml per day. Once again, less than 400 to 500 ml per day, that is technically known as what? Oliguria condition, and that is very characteristic clinical presentation of pre-renal ARF. Yes, so that is one phenomena. When GFR decreases, what happens? Decrease in filtration. Our filtration is mainly emphasized on what? Filtration of the waste material. Which kind of the waste material? Nitrogenous waste material. So when GFR decreases, there would be the less filtration of nitrogenous waste products or materials, and that is why if they are being filtered less, they are getting eliminated less in the urine. So there would be the more accumulation of those waste moieties in the blood. So we can write accumulation of those waste material, mainly what? Urea and creatinine. Yes, urea and creatinine are getting accumulated in blood, and clinically it is known as azotemia. Okay, so in nutshell we can say that in this condition GFR decreases, leading to two conditions. One is oliguria and another is azotemia. So that is about the pathogenesis of pre-renal ARF condition. But story doesn't end here. Story doesn't end here. What happens next? When the GFR decreases, body doesn't sit like this. Body try to do something. Okay, body try to uplift this GFR. So what the body does? Body is responsible for the activation of the RAS system. As you all know, RAS system, that is a renin, angiotensin, aldosterone system. So after the declination of the GFR, RAS system is getting increased, stimulated through the juxtaglomerular cells, and Through that, we are having activation of two moiety. One is angiotensin 2 and another is aldosterone. Angiotensin 2 is responsible for vasoconstriction. There would be the massive vasoconstriction in the arteries, and through that, if the vasoconstriction occurs, as our logic says, there would be more pressure on the blood. So more and more blood supplies towards the renal system, and that will increase the renal perfusion. So through angiotensin 2 induced vasoconstriction, the renal perfusion increases, and here's how we get rise in the GFR. Not only that, we are having the activation of aldosterone. What is the function of aldosterone? Aldosterone is responsible for sodium water reabsorption from the kidney tubules, convoluted tubules. So more sodium is getting reabsorbed, more water is getting reabsorbed, and that is why there would be the volume overload. In circulatory system, blood increases. Please pay attention. Here we have seen loss of the fluid, absolute and relative. Here what aldosterone does? It is responsible for the regain of the water which is being lost. Are you getting the point? So water is getting regained, and that is why the blood volume increases. There would be the volume overload, and that is why renal perfusion increases. And that is why we can achieve what? Increase in GFR. So RAS system activation is very good in context of this particular purpose or phenomena, right? But what happens? It is good, but pay attention here. But when the RAS system activates, there would be the activation of aldosterone. Now the aldosterone is not only responsible for sodium water reabsorption, it is also responsible for the reabsorption of what? Urea. What is urea? Urea is nitrogenous waste product. So when the RAS system activates a lot, there would be more activation of aldosterone, there would be more reabsorption of urea, and urea remains in the blood a lot, more accumulation, and that will lead to what? Worsening of the condition of azotemia. So in nutshell, we can say RAS system activation for a short period of time is very good. That is a healthy phenomena, but it persists for a long period of time. There would be the worsening of the azotemia, and azotemia related clinical manifestations, azotemic syndrome may occur, and that will harm our body. Okay, so that part is also very necessary to write and understand in the phenomena of pathogenesis. Now last but not the least, as we have understood the etiology, but there are few drugs also responsible. I just name the drugs responsible with their major function. One of the major drug responsible for prerenal ARF, that is ACE inhibitor, angiotensin converting enzyme inhibitors. They are the major anti-hypertensive drug. Another, that is NSAIDs, non-steroidal anti-inflammatory drug.